Hello, everyone. My name is Fernando López-Ríos. I am a molecular and thoracic pathologist based in Madrid at Hospital 12 de Octubre, where I lead the molecular diagnostic service. And I want to talk to you today about actionable fusions in solid tumors. So this is a fascinating area because we now have to test for actionable fusions not only in patients with non-small cell lung cancer, where we actually started more than a decade ago, but also in patients with other tumor types across many different histologies in what is now called a tumour-agnostic approach. So let's start by trying to understand fusions. A fusion is a novel gene product that can arise from genomic rearrangements. So we have to be careful not to confuse fusions with mutations or amplifications, which are the three main ways of oncogenic transformation that are now actionable in patients with solid tumors. We can look for fusions by using any PCR-based method, but currently the gold standard is next-generation sequencing, particularly RNA-based NGS, because this is more sensitive than if you just use a DNA-based NGS. You can also use real-time PCR or break-apart FISH, which has traditionally been the gold standard method in the field. And finally, we are lucky because many times we can use immunohistochemistry. In the case of ALK fusions, this is the final method. We don't need to confirm positive findings with another methodology. But for the rest of the fusions, if we find positivity, we are going to need a genomic confirmation after that. So the main actionable fusions that we are now looking for in our patients are ALK fusions, ROS1 fusions, RET fusions, and of course, NTRK fusions and FGFR fusions. So as I said at the beginning, ALK, ROS1, and RET are mainly found in patients with non-small cell lung cancer, but now we are starting to understand that sometimes we can also find them in other histologies in this tumor-agnostic perspective. And NTRK, as you know, has been developed from the beginning as an agnostic target. And FGFR fusions can be found in patients with bladder cancer, for example, but they are also being now developed in a tumor-agnostic manner. So in summary, actionable fusions can be found not only in patients with non-small cell lung cancer, but also in other histologies, and the ideal method to make sure that we don't miss any of these patients is RNA-based next-generation sequencing.